Thank you so much for taking the time to be here today. And I'm really looking forward to getting to share some of the main results from the 2022 Kisii County Department of Health Satisfaction Report. So here's a table of contents. This is the order that I will follow for this presentation. So as a refresher, the purpose of this study was to understand the level of satisfaction with KECOP programs, outreach, and activities from stakeholders within the Kisii County Department of Health. The objectives are listed below, and these ranged from learning how the partnership between KECOP and the Kisii County Department of Health can be strengthened, to understanding the level of support and funding for maternal and child health programs. The study design was in-depth interviews that were all conducted in July of 2022. They were conducted either at KECOP's office, at the Ministry of Health, or at the facilities where the participants worked. Participants were intentionally selected to capture a diversity of experiences and perspectives, and the population of participants were, oh, I see Anne joined. Let me see if I can admit. Okay. Should be joining us soon. So let me just pause for a second. Hi, Anne. Thank you so much for joining us.
Yeah, hi, how are you?
Good. It's nice to see you. So I just started going over the methods now. So the population of participants, they were 12 Kisii County Department of Health stakeholders from Kitutu Chache North, Kitutu Chache South, and from the Kisii County level. So some examples of these participants, we had a county executive committee member for health services, sub-county medical officers of health, sub-county reproductive health coordinators, and then clinical officers in charge at various facilities. The 5 guiding research questions are outlined on this slide, and those ranged from understanding the role of the Ministry of Health within maternal and child health in Kisii County to understanding ways to improve the long-term sustainability of KECOP and its programs. So for the analysis, I used Excel, and I will go ahead and open the actual document because I recognize that is probably illegible. But yeah, so my process for the analysis, are you guys able to see the Excel document now?
Yes.
Okay, great, thank you. So I organized by research question and then the sub-questions within those 5 research questions. And then each participant had their own row. So my process was, while I would listen to the audio recordings of the interviews, I also had the transcripts on my screen so I could follow along. And then I just took notes as I was listening and reading. I bolded some of the main ideas that emerged. And then at the bottom, I created a main themes row. So in this row, I pulled out all of the major ideas that emerged from the interviews. And then additionally, if there were any really impactful or important quotes, I also pulled these out to have them here. So yeah, it's definitely a very large Excel document, but it was pretty easy system for me to follow once I got started. Now I will go back to the presentation. Okay. For some reason. Oh, okay. Okay, now we should be back. So yeah, now I will just jump into the results. I organized these by the 10 primary themes that were either within the research questions or that emerged from the data. So the first was major issues facing maternal and child health in Kisii County. Staffing was frequently cited as the greatest challenge to delivering maternal and child health services, as well as commodity shortages, which included both like drug shortages and non-pharmaceutical shortages. Additionally, accessibility and transportation issues were frequently cited as a major challenge, and accessibility issues were related to poverty, facilities not operating 24 hours a day, power outages, the frequently delayed ambulatory system, and then long distances between facilities and communities. And then the third primary issue was suboptimal knowledge in the community about pregnancy danger signs, the importance of attending A&C appointments, and the importance of giving birth in a facility. So some recommendations include increasing staff numbers, installing more solar panels at different facilities to enable 24-hour care elsewhere, improve the ambulatory system. The participants didn't quite go into detail about what that would look like, but I will go into more. I actually, they did talk a little bit about ideas for improving the ambulatory system, but I talk about that later. And then continue to work with CHVs to educate the community. The level of funding for maternal and child health was frequently cited as inadequate, and then this lower level of funding was cited as negatively impacting the motivation of CHVs and staff. So several participants repeated how important it is to ensure that CHVs are provided with sufficient stipends to ensure they're engaged and motivated. As far as the perception of KeyCop's work in health facility strengthening, overall the perception is very positive, and participants noted how facility improvements have led to a sense of ownership and consequently higher utilization among community members. Additionally, there's evidence that staff are more motivated, that these improvements have occurred within their department. And solar panels were frequently cited as a really important health facility improvement. So some recommendations: install solar panels at Iranda, build theaters, which I will go into more detail in another section about that comment, building theaters within these lower level facilities. And then again, increase staffing to really capitalize on these health facility improvements. In terms of perception of KeyCop's efforts in community mobilization, again, very positive, and there's evidence of satisfaction among both community members and among staff. Participants mentioned how training and providing stipends for CHVs has been a really important contribution from KeyCop. And participants also said how CHVs are really critical to the community mobilization efforts, and that they are really trusted and respected within the communities. So some recommendations for further improving community mobilization efforts. Some ideas were to create a forum where CHVs and TBAs can speak to hospital teams about challenges and successes in the field. And then additionally, continue to support CHVs and also consider income generating activities for CHVs. No one went into detail about what those activities might look like, but it was repeated several times that considering income generating activities could be a good idea. The partnership between KeyCop and the Kisii County Department of Health was overall seen as a very strong working relationship with evidence of good communication. The integration with KeyCop was cited as increasing staff motivation, But one potential drawback of this partnership is that the Department of Health may be too dependent on KeyCop for support. So recommendations for improving this partnership include more engagement at the sub-county level, more frequent review meetings where people can review program updates or share data. One participant also mentioned how they would prefer to see KeyCop serve as a strengthening partner rather than have a leading role. And some other ideas for KeyCop's role within the partnership were to assist more with data and with the monitoring and evaluation process. And a few participants mentioned that they would like to see a stronger mechanism for conflict resolution and communication between KeyCop and the Department of Health. On the topic of how obstetric and neonatal care can be improved to limit referrals, the main ideas were further facility improvements, increase staff numbers, and limit drug and commodity shortages to improve the care that's provided. CHVs are an important, have helped improve the referral system by tracing and referring pregnant mothers. And staff burnout was cited as something that negatively impacts the care provided. So a recommendation for addressing that, this is a very repeated theme, but increased staff numbers. Also equip maternity wards with more supplies. There's a more comprehensive list of the supplies that were suggested listed within the report. One participant also mentioned that it's important to make spaces more comfortable for mothers. And then participants mentioned that if they had operating theaters at these facilities, there would be less of a need to refer mothers because they could perform C-sections or other procedures within these facilities. And then another participant mentioned that having a portable ultrasound machine would also help limit referrals to higher level facilities, which can be prohibitively expensive for some mothers. So that was another idea for improving care and limiting referrals. The primary challenges to the referral and ambulatory system, the first, delays in recognizing when referrals are needed by healthcare providers, and then delays in transporting patients due to a shortage of functional, fueled, and available ambulances. Another challenge is community attitudes surrounding the cost of care, the perceived inaccessibility of facilities, and comfortability with one provider already. These all limit the effectiveness of the referral system. So some recommendations to improve this include increased staff numbers to allow for more patients to be treated rather than referred. Staff trainings to be able to quickly recognize when referrals to higher level facilities are needed. And this is the idea that I mentioned earlier. Several participants expressed a desire to have a standing ambulance at all facilities to address these delays in getting an available working ambulance to patients in need. And then another recommendation would just be to address the road network. The solar projects were frequently cited as one of the most important contributions from KeyCop, and they have been hugely beneficial. These solar projects have also increased commitment from staff. Mothers especially love the solar project and the perception of security that the lights bring. And just to know that if they show up at night, they can be admitted instead of potentially turned away. So many participants mentioned how the ability to provide 24-hour care and assist with night deliveries has been really key. And an additional benefit is reliable vaccine storage. So recommendations: participants would love to see solar panels installed at more facilities, and some ideas for where the savings from electricity costs could go are towards further facility improvements, non-pharmaceuticals, drugs, and to pay lower level staff. These are the final two topics. Strategies for long-term partnership and sustainability. There were mixed responses regarding the perceived sustainability of KeyCop without Cure America's support. On one hand, the community is familiar with KeyCop's work and staff have been empowered, but the unit is very young and there is a lot of system strengthening that still has to be done. Participants repeated several times that government support and stipends for CHVs would be critical to sustain the program. So some strategies, some recommendations for sustainability include having KeyCop partner with other NGOs in the area that work on broader maternal and child health work, like adolescent, sexual and reproductive health, or family planning. But yeah, other related work. Also, if KeyCop could assist with grant writing, that would be beneficial. And participants noted that because support for maternal and child health kind of depends on who's in charge of the government at that time, lobbying for maternal and child health funds would be necessary to continue to support KeyCop's work. And then one participant had the idea of partnering with community elders to promote sustainability. And finally, some other ideas for improvement. Participants would love to see KeyCop's work further expanded to other facilities. Several participants had the idea to partner with health universities in the United States to promote knowledge exchange and sharing of best practices. Another participant noted that it would be really helpful if KeyCop could assist with finding and installing a clean source of water in all the facilities. Another participant said it would be helpful if KeyCop could perhaps help provide stipends for sanitation improvements at the household level, that's an important element of maternal and child health. And then finally, one participant mentioned that it would be helpful if KeyCop could help with strengthening the capacity of healthcare workers and strengthen the relationship between healthcare workers and CHVs. Although they did not go into detail of what necessarily that would look like, but I thought it would include that. And now to briefly just go over some of the limitations. 12 is a relatively small sample size, but I still think it covers a diverse range of perspectives, although obviously you can't capture everything. There's additionally the potential for bias during the interview process. Participants may have felt pressure to provide responses that they thought would be perceived more favorably by the research team. And then the moderator may have unintentionally influenced the direction of the interviews through like follow-up questions or whatever. So additionally, the data was only analyzed by myself, so this could definitely impact the reliability and objectivity of the findings. In conclusion, Kisii County Department of Health stakeholders are very pleased with the work KeyCop has done in health facility strengthening and community mobilization. Major successes of the partnership include KeyCop's assistance with staffing facilities, training and providing stipends to CHVs, and installing the solar panels at Matongo and Niagoto. The partnership between KeyCop and the Kisii County Department of Health is strong, but efforts are needed to ensure the sustainability of the program. And finally, participants would like to see KeyCop's work expanded to other facilities so that more communities can see similar improvements to maternal and child health. And thank you very much. And I would be happy to answer any questions you might have.